the lymphoid and hematopoietic system disorders. So of course, as in all the other presentations that I make, always it's important to remind yourself of the anatomy and physiology, because those are the foundations that would help you better understand any disorder, any disease that we have in our body. So always, even in your practice out there, whenever you get a condition, always go look, revise your anatomy, look at the physiology, then now read the disease. Then it will help you understand better. So we start with the lymphatic system, which we did cover in Pathology 1, not Anatomy 1, and suppose even in Anatomy 2. Lymphoid tissues and also the organs that are there. So you see, for example, the main one that we have, that diagram is not so clear, but I think you can just discern. You can see around the mouth, for example, we have the tonsils, palatine tonsils. That is the one that is more common. Then when you talk about tonsillitis, most people will be referring to those palatine tonsils. And then also we have, of course, adenoids. Adenoids is part of the of those tonsils. And then we have some mandibular nodes. So we have those tonsils around the mouth, that is behind at the oropharynx region, and we call it our Waldeas ring. So they're basically supposed to guard the body against any foreign bodies as you take in the food that we take. They're called Waldeas body, those ring. We have adenoids, we have palatine tonsils, and others. It forms almost like a circle. That's why they're called, Waldeas ring. And they are basically supposed to protect our bodies against anything during whatever food we ingest, as opposed to be able to check and try to deal with the bacteria, the viruses that we take with the food. And then, of course, lymph nodes are other, lymphoid organs that are important in the defense of the body. So we have lymph node in many, many areas. Around the neck, we call it cervical nodes. Below the mandible, we call them some mandibular nodes, and you can have nodes everywhere. In the axillary region, we have lymph nodes. At the inguinal region, we have lymph nodes, iliac nodes. We have even popliteal lymph nodes. Those are popliteal will be lymph nodes that will be found behind the knee. That region, we have popliteal, among others. And then, of course, we have lymphatic vessels all over the body. Lymphatic vessels that we know that finally we have two major lymphatic that will mainly drain most of the body. Apart from the right upper limb and the right upper chest and maybe the head and neck. So we have the biggest one will be the thoracic duct. And then we have on the right side, we have the right lymphatic duct. Those are the ones that finally will bring the lymph into the blood vessel. So around the subclavian vein, that is where finally you have the lymph drained into the blood vessels, into the blood eventually. And of course, another important organ, lymph organ that is important in the defense of the body is a thymus. And you can see where it is located in the mediastinum. In the mediastinum, that is inside the chest. And then we have another organ that is important in the lymphoid system is the spleen. One of the functions of the spleen mainly would be to filter blood and also to destroy old blood cells. For example, old red blood cells will be destroyed in the spleen. So that is some of the importance of the spleen. And then, of course, we have those lymph follicles in small intestine. We call them Peyer's patches in the ileum. Remember, I know all of us know about the ileum and the jejunum. So in the small intestine, we have what we call Peyer's patches. So basically, there are lymphoid tissues that are found within the wall of the small intestine. We call them Peyer's patches. So all those ones are supposed to, and then of course we have in the intestine mainly we have lymph node, intestinal lymph nodes. In the mesentery, in fact, most of the lymphatic tissues, most of them are found in the mesentery of the of the intestine. And of course, bone marrow is one of the main lymphoid tissue. You know that for the bone marrow, that is where most of the red blood cells, most of the cells, blood cells are produced. And so it's an important lymphoid tissue, the red bone marrow. Um, Moving on, we have a lymph node, so we are focusing on the lymph nodes because lymph node is one of the major lymphoid tissue that is found. And you saw basically one of the functions of the lymph node will be to filter, that lymph, from, as you can see in that lymph node, we have the structure of a lymph node. For example, the outer surface of the lymph node, we have a capsule, and then we have the reticular tissue, and then we have the efferent lymphatic vessels. The efferent are the ones that are coming in. Afferent with A. So the one that is coming in, bringing lymph from the rest of the body into the lymph node. So afferent lymph vessels. And then you can see, even as last time we talked about lymph vessels, they have a valve. Most of them are valves. So you can see just like veins, and basically those ones prevent lymph from flowing backward. And you can see that it comes in, and there are these lymphoid follicles that are supposed to start the process of filtering the lymph as it comes in. And you can see the trabecular. That means basically when you look at the capsule, there are some parts of the capsule that go in, forming, separating the lymph node into compartments. Those are the trabecular. And you can see how the and of course you can note that in the lymph node, the flow of lymph will be very slow. So usually if there is metastatic cancer cells from other parts of the body coming into the lymph node, they're likely to grow in the lymph node because there it is slowed. The lymphatic fluid is slowed there in the lymph node. And so metastatic tumors, cancers are likely to grow in the lymph nodes. And then you can see how they are flowing out, and eventually they go out through the efferent lymph vessels at the hilum of the node and flows out. Of course, lymph node, just like any other organ in the body, have to have a blood supply. And you can see the blood supply, you can see the artery, and you can see the vein coming in. And then you can see in those follicles, that is where you find the lymphocytes and macrophages. That is where lymphocytes and macrophages. In fact, remember, lymphocytes are produced in the bone marrow, but they mature and actually attain activity in the lymph node. That is where basically they are activated, because that is where they are exposed to antigens. Antigens could be any foreign material like virus or bacteria. So they are primed there so that they start acting as dealing with foreign materials, antigens. We have there histology, that is basically microscopic anatomy of the lymph node. You can see there is the capsule, and you can see there is the germinal centers. That is basically in the follicles. There is the follicle, and those follicles mature to develop a germinal center. An electron micrograph showing a lymph node tissue. And of course, in the lymph node is where you'll find lymphocytes. It's where you find macrophages, that are ready to be able to filter the lymph that come in, so that if there was bacteria or other viruses or other foreign material that comes in through the lymph, they are able to be dealt with there by lymphocytes. Because basically what we are dealing with is that part of our body that really deals mainly with the defense system of our body against infections. And then you can see spleen. Spleen is one of the organs that I said is a very important lymphoid tissue or lymphoid organ. And so unlike the lymph node that mainly filters lymph, in this case, the spleen mostly filters blood. So blood will come in, They are filtered for any foreign materials, bacteria, viruses, or others. That is where they are filtered. And also one of the functions, as I had said, of the spleen is basically to destroy all red blood cells, especially, and also stores platelets, so that sometimes our spleen acts as a reservoir. So it is able to keep a lot of uh, platelets, and also it has a very big store of red blood cells, so that when there is an issue with blood is not enough, it's able to be released from the spleen for the purposes of circulating in the rest of the body. And you can see where it's located. I think we talked about this when we talked about, in anatomy T, you need to know where the spleen is located in our bodies. And then you can see, if you are to section, you cut through the spleen and look at the detail of the histology. You can see the capsule, you can see the trabeculi. That is basically the extension of the capsule, and the cortex mainly into the substance of the spleen, separating into compartments. And in the spleen, we have the white pulp, and then we have the red pulp. White pulp is where you have the lymphocytes, where you will have the lymphocytes. And the red pulp is where mostly the old red blood cells or the red blood cells will be mainly stored. And of course, you can see, like any other organ, it has to be supplied. We have the splenic artery, which all of us, if you remember, is a branch of the celiac artery that is originating from the abdominal aorta. And then you have the lymph vessels, and then you have the splenic vein. So it has to have supply from the arteries, and also it has to be drained by the veins, and there has to be also lymph vessels supplying the same. Another important lymphoid organ is the thymus. Yeah, you see it has two lobes. There is the right lobe and then the left lobe. And you can see where it's located in the mediastinum, in the superior mediastinum. And you can see their relations with the other organs, the lungs, the right lung, the left lung. And mostly thymus is very active, especially during neonatal period, that is during childhood, and mostly it reaches from puberty up to around puberty, and then it starts atrophying. Yeah, so after puberty it tends to atrophy, that is become smaller. Yeah, but very active during early childhood, neonatal period, and just before puberty, and then it starts atrophying in size. And mainly thymus is where the lymphocytes are mature. Yeah, usually when they are produced in the bone marrow, they are naive. That is, they are not mature yet. So they basically mature, the lymphocytes mature in the thymus. And then, of course, we see, looking at the bone marrow, the production of blood cells, in the bone marrow. You see, it starts with a multipotent stem cell. And we talked about stem cell, I think, in Pathology 1. Yeah, so you know what they are, the stem cells. And so they differentiate, so that you see, finally, we have the myeloid path. The myeloid path we call trilineage. That is basically, it has three. Yeah, where you have the granulocyte, monocyte, progenitors, where you end up with granulocyte, CSF is colony stimulating a follicle there. So you are able to produce all those cells, like the neutrophils, basophils, eosinophils, and monocytes from that lineage of the myeloid. Also, among that myeloid pathway, you have the erythrocyte, where finally you produce erythrocytes. Those are the red blood cells. And also you have the megakaryocyte progenitor, where finally you produce the platelets. And then, of course, we have the other pathway of lymphoid stem cell, where now you get the lymphocytes, where you have the B cells, mainly those ones mature in the bone marrow, but thymus, you have the T cells maturing there, and then we have also the natural killer cells. So those are the cells that will be produced in the bone marrow and the various places where they mature. And the fixed macrophages in the body, basically these are another name they would use is histiocytes. Yeah, and every part of the body. So we have these macrophages that mainly are within the tissues. They are within the tissues. For example, in the brain, we have what we call microglia. Those are macrophages within the brain. And we know macrophages are basically cell eating. They engulf foreign material, be it bacteria, be it viruses, or any foreign material that get into the body, or even dead cells. Yeah, if we have necrotic cells, they are supposed also to be engulfed, to be destroyed by these macrophages. So in the brain, we have microglia. And then in the alveoli, that is in the lung, we have alveolar macrophages. And then in the lymph nodes, we have what we call sinus lining cells. And also these ones will be found in the spleen and thymus glands. And then in the liver, we have hepatic macrophages. We call them Kupffer cells. That is in the liver. And then in the kidney, we have mesangial cells in the glomeruli of the kidneys. I think we talked about it last time. And then in the synovial cells, those are mainly in the joint, the synovial joints. We have synovial cells that act as macrophages. And then, of course, in the bone, we have osteoclasts in the bone that are supposed to also act in resorption of bone, osteoclasts. And then in the skin, we have what we call dendritic cells. So all those are macrophages in the various parts of the body. Functions of lymphoreticular system. So we're looking at the functions of what we've talked about, the lymph node, the lymphatic system, including those organs like the lymph nodes, the spleen, the bone marrow, among others. So these are some of their functions, mainly to generate immune responses. The main organs and tissues include thymus, spleen, lymph nodes, bone marrow, malt. Malt is mucosa-associated lymphoid tissues, such as tonsils, the one we have talked about, the Waldeus ring, where we have adenoids, we have tonsils, we have various tonsils around the pharynx, oropharynx, nasopharynx. So we have malt, so mucosal-associated lymphoid tissues, such as tonsils, and Peyer's patches. Peyer's patches is the one that is found in the wall of the small intestine, in the ileum. And all those deal with issues of immunity, dealing with foreign materials that enters our body. So lymphocytes are produced in the bone marrow, as we already said. So many lymphoid cells circulate through the peripheral tissues via blood and lymphatic vessels. So most of these lymphoid cells, they circulate through the peripheral tissue, so through blood and even through the lymphatic vessels. So monocyte macrophage system include tissues macrophages, which are found virtually in every organ. So that the one that we had just talked about, the fixed macrophages. So they are found all over the body. And we talk about monocyte. Remember, monocyte is one of the blood cells that we talked about, that when it enters the tissues, they become macrophages. So monocytes will be within the blood, but when it gets out of the blood into the tissues, becomes macrophage.